I'm going to tell you a little bit about the Scottish Hepatitis C Action Plan. I've spoken to at this conference in the past about the action plan. So today I'm going to give you more of an update on progress, but I'll give you some context as well, because some of you will probably not know much about the plan. Let's move on to the first slide here. Well, the action plan down here, phase 2, 2008 to 2011. An enormous amount of activity preceded the action plan, and it's worth, I think, highlighting 5 key players that really influenced the establishment of the action plan. Naturally, the people who generated considerable amount of data, epidemiological data, so we understood what was going on in the country. Also here, the pharmaceutical industry. They often get forgotten about, but they were absolutely crucial. Without the developments on the therapeutic side, this action plan wouldn't have got off the ground. Clinicians, of course, here and over here, and of course patient advocate groups, terribly important in promoting advancement in this area. And then finally, politicians. And politicians were extremely helpful. And all these players, I think, came together. And without one of those players, I think we probably wouldn't have got the plan off the ground, or it would have been a lesser plan. So they all acted together to generate this plan. And the aims of the plan, you'll know about: prevention, diagnosis and care. So it's right across the board, the whole spectrum. Phase 1, 2006 to 2008, 41 actions. Most of those actions involved generating evidence to inform service development for the next phase. Recommendations which were considered by all our stakeholders, and these recommendations really are the essence of the Phase 2 action plan. And then just taking you through some of the data that we had at that particular time and putting it in context in terms of what's happening now. You can see here that we had 38,000 people alive with chronic hepatitis C in 2006, of whom under half had been diagnosed, just 20% in specialist care, and then just 5% having had treatment. Very, very powerful data when it came to convincing the politicians and then the government that we needed to do something. 2008, well, that figure, 38,000, that's gone up to 39,000. The diagnosed has gone up to 15,500, which actually means there are now even more undiagnosed people in Scotland infected with HCV. Number in specialist care, that I think has gone up to about 10,000. And the number having received antiviral treatment has gone up to around the 3,000 mark. So there has been, that's 2008. Of course, the plan is 2008 to 2011. So it's going to take time for us to see major developments in that respect. These are the number of individuals. They've been cut off a bit here, but the number of diagnoses, HCV antibody positive diagnoses, and at the 2006 time, we were talking about around 22, 23,000 diagnoses. That's gone up to 25,000. And you can see a slight increase in the number of people having been diagnosed. That may well be an action plan effect, certainly a phase 1 effect if it is. And the only other thing to note here is the change in the age distribution of diagnoses. You can see that around half in the late 1990s were under the age of 30. That figure is now around about a third. Is this due to injecting drug users starting to inject at a later age, or are we just getting better at diagnosing people who are older, or is it a combination of the two? Probably a combination of the two. And then trends in infection and disease, and you can see the rise in the number of cases of HCV-related liver failure in Scotland. We'd come up to around about the 120 mark. By 2008, this had come up to about 150. The number of hospital bed days associated with HCV, 4,500. That's now moved up to 5,000 by 2008. And then, as you can see, the number of HCV-related deaths far in excess of AIDS-related deaths, and that has moved up from around about 100 to 120 as at 2008. Here we have prevalence of HCV among injecting drug users under the age of 25, recent initiates to injecting, and you can see the quite dramatic drop in prevalence in the very late 1980s, early 1990s, plateauing. That's 2006, and the 2008 data show more or less the same, continuing prevalence of about 40% among this population, indicating that incidence of infection is relatively stable. And then the Action Plan Phase 2 launched in May 2008, and just briefly, the characteristics of the plan: it's based on an extensive evidence base. It's a high-level one. We're not particularly prescriptive, and that's because the epidemiology of HCV is very different across all the 14 health boards in Scotland, and because everyone was at a different stage in terms of service development. It embraces all service needs, from educating school children up to provision of antiviral therapy. It adopts a multidisciplinary approach. We're very keen to ensure that people from all the different sectors were involved, from voluntary sector, from primary care, local authority, the prison sector were involved. It covers all geographical areas and settings, particularly the prison setting. And this reflects the fact that about 20% of our inmates in Scotland are infected with hepatitis C. It's performance managed, so we've got targets and we've got a programme management approach, and it addresses inequalities. No other condition, I think, is more associated with deprivation than is hepatitis C. If there is another condition that's more associated, please let me know.